You may not even realize this, but drug companies spend more money on marketing than they do on R&D. Turns out that a lot of the R&D is actually paid by taxpayers. In the United States, the NIH, that's the National Institutes of Health, is actually funding a lot of the drug company R&D. And as a result, taxpayers are paying for their R&D. So drug companies are free to spend all their money on marketing, which is spent on direct-to-consumer advertising to brainwash gullible, low-information consumers to ask for certain brand name drugs at their doctor's offices. Now, in the last 2 years, let's see, I'm reading this from market research from Kantar Media. Advertising dollars spent by drug makers have increased by 30% in the last 2 years to $4.5 billion annually. $4.5 billion. I think it's higher than that, by the way. The other thing that's going on at the same time that commercial spending is increasing, marketing spending, the prices of these drugs is also skyrocketing. And the cost of a pill that used to be, let's say, $4 might now be $20 a pill. And it's driving everybody into bankruptcy. Everybody, every family in America is touched by this, affected in a negative way. Shouldn't say touched, more like pilfered, more like robbed at gunpoint, mugged. Welcome to our hospital. Are you ready for your mugging? Please undress so that we can mug you in the nude. Yeah, sign here to be mugged. And in exchange for agreeing to be mugged, we will give you these little pills that will probably screw up your liver and your kidneys, make you fart 12 times a day and lose your memory. So you'll wake up smelling funny and you won't remember who you are. But if you do, come back to the hospital. We'll give you another drug to treat the symptoms of the first one. All right, so that's what drugs, that's what the pharmaceutical industry is really all about, is hiking up the cost of the drugs and hiking up the spending on television. So that's why the American Medical Association has now come to realize that this is going to destroy the entire medical system. It's going to make doctors obsolete because we're really rapidly approaching the point where virtually no one can afford to buy the drugs that their doctors recommend, which means there's no point in visiting a doctor. And so the AMA is now desperately calling for a ban on direct-to-consumer advertising of prescription drugs. Wouldn't that be great to free up all the airtime on TV? It'd be awesome. Instead of having all these silly drug ads that are basically lying to you anyway, showing images of happy, healthy people when their drug actually causes you to have a heart attack and die. That's the reality versus what they show you is like complete night and day, the opposite ends of the spectrum. Believe me, if they have healthy people shown or depicted in the ad, those healthy people are not taking their drug. If they were, they probably wouldn't be able to get up and move like that or look that good or anything. So they hire actors who don't take their drugs to portray their drugs as making you healthy, even though it's all BS. Now, one of the biggest side effects of all this, if it's banned, if these ads are banned, would be that it would radically change the formula of what happens in the mainstream media. You got to realize that the mainstream media right now is essentially financially infiltrated by big pharma. And this is why the media, which is totally dishonest, it is, mainstream media is run by the most unethical sellouts who would say anything and print anything to make a buck, even if it means harming humanity. They have no ethics whatsoever. And they will take money from drug companies, and then they'll write pro-drug articles and pro-vaccine articles and Western medicine articles, and then they'll attack the alternatives. Of course, they'll attack dietary supplements, and they'll attack medicinal herbs, and they'll attack acupuncture. And they do this because they get paid. In some media organizations, I've been told, up to 70% of their income is based on money from pharmaceutical companies. And they just run drug ad after drug ad after drug ad. And that's their revenue model. Basically just they've become prostitutes for the drug corporations. Is anyone surprised to hear this? Of course not. I mean, that's what the mainstream media is. I mean, these are people who come to work with their hands around their ankles. The first thing they do, they check in, got their hands around their ankles, walk up to their desk, and wait to get raped by the pharmaceutical companies. And then they turn around and abuse their readers, or abuse their viewers. And this is their business model, and they love it, I guess. I don't know. Maybe they have a fetish for it of some kind. Maybe some of them have been working with Jared Fogle, over at Subway. He's got some experience in that realm. And so anyway, they do it on a larger scale, though. They're not just raping, children. They're raping the whole freaking country. Everybody, adults and grandmas too, for that matter, because that's who's buying the drugs, right? That gives them the money. So, a lot of these mainstream journalists, their salaries are paid by blood money from drug companies that sell products that kill people, but they don't mind it. That's totally okay. Anyway, if the AMA gets its way, then this cash cow would be cut off, and all of a sudden you would find a willingness in the mainstream media to do actual journalism on the issue of pharmaceuticals and medications and so on. They might be willing to, I don't know, ask a legitimate question, conduct actual journalism, which involves asking questions instead of just being prostitutes and parroting the propaganda of the industry that writes your paycheck. So I think that for this reason alone, I'm all in favor of banning direct-to-consumer advertising, just because, well, I guess there are lots of reasons, but one of the main reasons is this media factor. If we could take the corruption, the financial influence out of the mainstream media from drug companies, we might actually start to get some honest reporting about those drug companies. And that, of course, would be really revolutionary in America, because right now, you can't get honest news about big pharma or vaccines, for sure. You can't get any honest news about vaccines from the mainstream media. You got to go to the alternative media, like my website, vaccines.news. Just check it out, vaccines.news, very popular site, or, of course, naturalnews.com. That's very popular. Also, check out medicine.news while you're at it. That's a pretty cool website as well, medicine.news. In any case, if the AMA gets its advertising banned on all prescription drugs, then I don't know, might put us out of business, because maybe the New York Times and the Washington Post would actually start to print the truth about drugs, and then no one would need to read my websites. That'd be totally fine with me. I'd be all for that. I could use a little time off anyway. I've been working hard, so I don't mind a break if they want to actually do their jobs. But I doubt it. I don't think they remember what journalism even is anymore. They just get press releases sent to them by the White House or the corporations, the advertisers. They just rearrange a few words, slap their name on it, publish it in the newspaper. Oh, that's a fact in the Washington Post. No, it isn't. It's Monsanto's talking points with your name on it, dumbass. That's what it really is. But they think they're fooling anybody. Give me a break. One time I was visiting a town, and I ordered a pizza, and this was many years ago, and I think I ordered like a 14-inch pizza, and it arrived, and it was 10 inches in diameter. And I actually got into an argument with the delivery person, and then ultimately their boss. I said, look, you think I can't tell that this pizza is not 14 inches? And their answer was, no, the 14 inches is the size before cooking. So, oh, really? So you're selling a 14-inch pre-cooked pizza that gets delivered at 10 inches. And, what kind of pizza dough are you using anyway that shrinks that? I mean, the shrinkage factor here is kind of scary. What the hell's in that dough? And what else is going on in your life that has massive shrinkage factors? When you go fishing, did you catch an 8-inch fish and now it's 4? What else is going on? I'm curious about your private life now. Anyway, same thing is true about, mainstream media. They write stories that are just copied and pasted from corporations, and it's fairly obvious. And they say, oh, well, all vaccines are proven safe and effective. The flu vaccine is wonderful. This year's flu strain is absolutely a perfect batch. You should get, nonsense. You're just a prostitute for the vaccine industry. Everybody knows it. People laughing at you, actually. No one even believes it anymore. So funny. All right, so let me get back to this press release from the American Medical Association. They're calling for convening a physician task force. Ooh, a task force. Are they going to wear like black bulletproof vests and shoulder pads and masks and stuff? Are they going to have rifles? Are they going to be like a SWAT raid team? Cool, man. All right, a physician task force. I love how they make themselves sound so important. We're gonna have a physician task force. You have you're gonna have a bunker with a command headquarters inside too. Okay, and quote, and launching an advocacy campaign to promote prescription drug affordability by demanding choice and competition in the pharmaceutical industry, and greater transparency in prescription drug prices and costs. Wow, that's asking for a lot. Did you know a lot of these drugs cost maybe 5 cents to produce and they'll sell them for $500? The markups are insane. It's not unusual to have a markup that's 10,000, 50,000, even 100,000% over the cost of the ingredients. A lot of people don't know that. Here's something else you might not know. These big corporate drug companies, they actually pay off generic drug producers to keep competing drugs off the market so that consumers don't have a choice of what to buy that's more affordable. Instead, they're forced to buy the monopoly drug that just came off patent often and not able to have access to the generic drug. So think about that. These are corporations that pay off companies to make sure that you have to keep paying monopoly prices even though there should be more affordable competitive options available. That's freaking evil. That's just like evil incarnate, and this is their business model. Now, these are the same people that commit felony crimes, the drug companies. They bribe physicians. They kick back hospitals. They engage in all kinds of criminal behavior. They use children in Africa for their medical experiments. They kill children sometimes too. I mean, this is the same people, the same kind of people that carried out Tuskegee, syphilis experiments on blacks in America. There you go. Same group, same kind of people. I'll be back after this break. Well, thank you for listening to this episode of the Health Ranger Report. Please support us by visiting our online store at store.naturalnews.com, where you can find the world's cleanest, laboratory-validated superfoods, nutritional supplements, personal care products, shampoo, chemical-free products, just about everything for your home and body and health that you might want, including supplements for your pets as well. Everything is laboratory validated in our forensic food lab, and we don't sell something unless it tests clean. I think we're the only online reseller to do this really extensive testing of everything that we sell. If we don't like the lab test results, meaning if it's not really, really clean, including with heavy metals, then we don't sell it, period. We have free shipping on orders over $99 and a satisfaction guarantee on everything that we offer. So check us out now at store.naturalnews.com, and thank you for your support.